Well, long drives to seek care can oftentimes mean more long-term damage for someone who's suffering a stroke, and the countdown is on the instant a patient begins to show symptoms.
And as part of our series, Bridging the Great Health Divide, News Channel 3's Kelsey Soto talked with providers in Southern Ohio about the quick choices that have to happen when trying to prevent irreversible damage.
When a call comes in to an emergency dispatch center of a possible stroke, minutes matter.
It is stressful. I mean, you think, I need to get there quick. I need to get there safely.
Susan Emmert knows all too well and has spent 46 years of her life serving others, both as a paramedic and 911 dispatcher. When a patient begins showing symptoms of a stroke, she knows there's no time to waste.
That's why we're here. You call 911 and we will come and get you the assessment that you need.
But often the clock works against them. In rural Jackson County, Ohio, some ambulance rides can be about 40 minutes to the nearest hospital. Doctors have about 4.5 hours from onset of symptoms to determine what type of stroke a patient is having and if they're a candidate for clotting medication.
They won't call it a transport, but they can come in here and help us.
Thanks to a partnership with Ohio State University, this robot allows local doctors like Jonathan Hess to immediately connect with specialists.
This is a great game changer, so you can have someone whose whole life and professional career is based on stroke neurology to be there with the ER provider to help make those decisions.
At Holzer Medical Center, that may be just the first stop on a patient's journey to survival and recovery. Major hospitals are more than an hour and a half away by ground and about 20-something minutes by air.
Don't take that chance for possible lifelong of not being able to think straight or use a certain arm or leg.
From EMTs to ER doctors and neurologists, there are important and critical split-second decisions that can save a life, making every high-stakes moment worth it.
Just this past week we had one that we did not think that she would survive, but came back in and thanked us.
These healthcare heroes say it's precious time we all could use a little more of. Kelsey Soto, WSAZ, News Channel 3, Jackson County.
Now, the CDC says that for adults 35 and older who suffer from a stroke, 73 out of 100,000 of them die.
The three highest counties in our region for stroke deaths are Gallia, Vinton, and Meigs in Ohio. Those are areas significantly above the national average. And we also have numbers for West Virginia and Kentucky right now on the WSAZ app.